Hello, this is Dr. Gay from First Look MRI, and this is just a short, quick video for just lay people who don't do MRI for a living, just to show you what we see in MRI and just some really basic anatomy. So it's just a bread and butter case I saw today, and just has some simple findings here that we see every day. So this is a shoulder. We're looking straight at the shoulder. This is a 51-year-old male with shoulder pain, and we see this round thing here. This is the humeral head. This is the humeral neck here, and this is the shaft, the bone that goes down to the arm. On the outside, we see the deltoid muscle to get oriented. So we're looking straight at this person, and the humeral head rotates within this cup here. This is called the glenoid, part of the scapula. And so the shoulder joint is really this right here, the humeral head rotating within this cup. And above this joint, we have another joint that's smaller called the AC joint, the acromioclavicular joint. So the acromion is right here. The clavicle is right here. It comes all the way sideways, ends right here. Again, this is the AC joint. So this patient has a few findings. Number one is this AC joint. You can see it does not look normal. There's darkness in the bone. We see that the joint, instead of being nice and smooth with a nice gap, the gap is gone, so they have loss of the normal joint space. There's spurring. It looks like a bird's beak going downwards, and it is pushing on something that's coming sideways here. So this thing coming sideways is part of the rotator cuff. The rotator cuff is a bunch of muscles that come across sideways, and they attach way out here on the outside of the humerus. So this is the top of the rotator cuff, but there's also a back of it. Here's part of the back over here coming across. There's a top of it and a front of it, so it wraps all the way around the top of it, and back of it and front of it. So the top of it on this patient is getting pushed down by this AC joint. It's enlarged and has spurring, and it's pushing down, indenting it. And when it pushes on it like that, it can cause irritation and lead to tears. And when people have symptoms, they call it impingement from getting pushed on by an external thing like this, like the AC joint. And this patient has a tear, and so we have a big gray muscle. This is called the supraspinatus muscle, which is just one of the four muscles of the rotator cuff. So the supraspinatus is the top one. This is the one that's most commonly torn. It comes sideways. You can see the muscle big and fat and juicy here. Then it gets skinnier and skinnier, and it turns into a black tendon where there's no muscle, just tendon. And the tendon will come down over here and attach on this flat part. We call this the footprint. And you can see right here, we put contrast in their joint. Contrast is white, and you see the white contrast right here. So this is within a tear. That dark tendon comes over, it stops, and there's a fluid-filled gap, and it should attach right over here on this flat part. So this is a full thickness tear of the rotator cuff with a little bit of retraction. Really common bread and butter finding here. Again, it may be related to this AC joint that's pushing down, resulting in shoulder impingement. There's one other thing on this patient worth noting. They have a biceps tendon that wraps up here. This is the biceps tendon. Comes down to the arm, it goes up, makes a loop over the top, and it attaches way over here on the glenoid. So the biceps has this long course. And the biceps, where it attaches underneath that, there's a little black wedge, a triangle that goes around the rim of this cup. And that is called the labrum, a little fibrocartilaginous dark band. That just helps the humeral head sit deeper within this shoulder joint, makes that cup deeper. And this patient has a little gray smudge right here, this vertical gray smudge. This is probably a little tear of that superior labrum. This is called the inferior labrum. Again, the labrum wraps all the way around. So this patient has a few things: AC arthropathy or arthritis of this AC joint. It's pushing on the rotator cuff, and that is causing, or probably causing, this tear of the rotator cuff here where it attaches. And then the last thing they have is a vertical tear of the superior labrum. It may be partially healed, that's why it's not showing up very well. When people have acute tears, they show up really well. You'll be able to see this fluid we injected going right in there. So this is maybe partially healed, that's why it doesn't show up so great. So bread and butter case of a shoulder MRI, and thank you very much.